So I don't have time to go through all these because I really do want to spend some time in Q&A. But a couple of things just to highlight in terms of what makes effective advocacy and campaigning. One is reconfiguring the battlefield. And again, this is a really important exercise for you to do a complete audit of what are your resources. What are your internal resources? What are your external resources? When I say internal, that could be expertise, that could be media talent, that could be a real evaluation of relationships that you have, particularly relationships that can influence the person that you're trying to change their mind, change the mind of. It's also really important to be able to what's called cut the diamond. You think about people that cut diamonds in, you name it, Antwerp. Oftentimes with the most precious diamonds, they'll spend months studying and analyzing that diamond, trying to figure out how to make the cut in just the way so that the diamond's going to shine the most. It's going to capture the light within the diamond. Well, in a similar way, you want to spend some valuable time analyzing the problem. That kind of gets back to those root causes I talked about. You want to try to analyze how do you cut this issue in a way that enables you to design a campaign that's achievable, that will help to illuminate this injustice, will draw people to your cause, and will ultimately create a change that is measurable and it's going to make a difference. There's a lot more kind of embedded in all that, but maybe if there's more time, I'm not trying to shamelessly plug the book, but there's a lot more detail in it if you're interested. It's called Mobilizing Hope. And there's lots of other good books out there that deal with some of the tools of advocacy. The other set of tools that are really important is public narrative. So there are many different issues out there. We live in an internet age, a TV age, where you're barraged with constant information. And one of the challenges of advocates is how do you break through the clutter? How do you penetrate that clutter and get people to pay attention to an issue that may be invisible, may be neglected, may be uncomfortable when people really know what's going on? And so this whole idea of public narrative is essentially how do we tell our story and how do we define or frame the issue in a way that elicits people's concern and ultimately their action. It is composed of three components. One is called the story of self, which is essentially your story. Why is it that you care about this issue? What got you into the issue in the first place? And oftentimes that's tied to real people. You went to a program in Malawi, had a chance to see vaccination programs on the ground that were saving children's lives. The second is story of us, which is kind of the next layer out. What is our story together? Who are we as the church? Why as the church should we care about this? Who is our story as a community? Who is our story as an organization? So it takes it one level out. And then the most important is the story of now. Why is there urgency around this issue? Why should someone act now? Why should they care about this now? Because otherwise, people will, maybe you prick their conscience and their heartstrings are pulled, but unless you give them something concrete that they're going to do, they're going to easily go back into the daily traffic of life and probably forget what they just heard you share with them. And so what a good public narrative does is it generates hope. No one likes to be involved in something that is hopeless. And again, that's why some of these overwhelming statistics you have to be careful about. And it has to generate a sense of urgency. Why now? One of the things that I think we as the church or as Christians possess that is really critical to tap into is our moral authority. So often we're not advocating because of our self-interest. Now, certainly organizations like World Vision, and I know that's not true of all organizations that are represented here, do get some money from the U.S. government. So when we advocate for more money for global health programs, there is some self-interest there. But more than that self-interest is our moral interest. We believe that this is the right thing to do. There's a moral imperative to save the lives of children that die at the age of 5 because of preventable illness or disease. There is a moral imperative to ensure that people living with HIV have access to life-saving treatment, life-prolonging treatment. And so, don't underestimate the power of this moral authority, because members of Congress and their staffers spend most of their time talking to people that are primarily speaking from a more pragmatic self-interest perspective. It's either their job, they're a lobbyist, or they're trying to represent the interest of their organization. When you come in with this moral authority, it really is a powerful thing. And again, the power of faith and hope is critical. So I want to give you a concrete example as I close. A lot of this, all these kind of concepts and tools can be a little abstract unless you make them real. I don't have time to tell many stories, but I want to share one from a campaign that was early on in my kind of development as an advocate and as an activist. I had the opportunity of attending the International AIDS Conference in 2002. Imagine at least a handful of people in this room were there as well. It was in Barcelona, Spain. And at that conference, Coca-Cola made this gigantic announcement that they were going to treat their workforce in Africa. Out of curiosity, how many of you like Coke, drink Coke? Sure. All right. Pepsi? It's a Coke crowd. Well, I'm actually very indebted to Coke. I went to Emory University, which is practically owned by Coca-Cola. One of the former CEOs of Coke, a guy named Woodruff, created a scholarship program that paid my way through college. So needless to say, I'm a huge fan of Coke. But Coke made this huge announcement. At that time, they were the biggest employer in sub-Saharan Africa. You could get a bottle of Coke in most remote places, whereas you could not get ARVs or other basic medicines. Incredible distribution network. Coke made this announcement, and we had actually been watching and hoping that a corporation would step forward and really make a commitment to treating their workforce. Both because it was the right thing to do, but we also thought it was the smart thing to do. Because ultimately, they'd be paying for replacement costs as their employees die of AIDS. So Coke made this big announcement. I got back to the DC, and I started reading some reports from some of our allied organizations that basically uncovered that in the fine print, Coke was only planning to cover the managers, 2% of their workforce. And it seemed like a real contradiction in terms of what the broad announcement was and what the reality was going to be. Now, to their defense, they claimed that they were going to roll this out over time and cover more of their employees. But there was no plan attached to when that was going to happen, how quickly, etc. So at that point, I had started a kind of ragtag shoestring organization called Global Justice that quickly grew and became a more robust organization a couple years later. But at that point, we had about 20 college chapters around the country. We were started the seed grant of $50,000. And we did have a chapter at Morehouse and at Emory, quite strategically. And we decided that we were going to take on Goliath. I mean, it really felt this like a David and Goliath situation. And we tried to cut the diamond. We said, what will influence Coca-Cola? So certainly did have major resources to do a big lobbying campaign. We had no lobbyists in Washington. But what we did know is that Coke is essentially sugar water. And it's extremely brand conscious. And Coke has exclusive rights, exclusive agreements with a lot of college campuses, where they're the only ones that are able to sell their product because of these contractual agreements. And so we looked at our network of 20 campuses, and we started this Kick Coke Off Your Campus campaign. We developed postcards that were designed or written to the CEO of Coke that were really trying to appeal to his conscience and get him to do the right thing. We organized some campaigns, kind of tabling campaigns on these campuses where we're getting students to write postcards and we're raising awareness about Coke's announcement. And we had some media events, particularly in Atlanta and New York, that really caught the eye of Coca-Cola. And there were other organizations involved, but students really played a critical role in putting this issue on the agenda. Within 3 months of this campaign, Coke made an announcement that they would roll out treatment for their entire workforce. And it was going to happen in phases, but it was a huge breakthrough. And I can't promise that every advocacy campaign is going to be that quick and it's going to be that successful. But when you cut the diamond in the right way and you have a very compelling message, and when you do a good job of figuring out what is the exact weakness, what is the Achilles heel of this corporation, this government official, campaigns really can make a huge difference. And so I want to leave you just with this last slide. It's my favorite proverb. It's not from the book of Proverbs, but it's an Ethiopian proverb that says, when spider webs unite, they can entangle a lion. And what I love about this proverb and this image of a spider web is that when you think about a spider web, each individual strand is very weak. easily be broken. But when it forms the web, it can entangle a line. It can entangle things that are so much bigger than the individual strands. And that's the power of advocacy and of activism, particularly when it's motivated by faith. We are the ones that form the spider web. The church is called to be the body of Christ. When one part suffers, all parts suffer with it. When one part rejoices, all parts rejoice with it. That is the very essence of what the church is called to be. And my question that I want to leave with you is this. Is the church simply going to allow advocacy to be an extracurricular activity? Or is it going to become part and parcel to who we are and how we're remembered? Put it another way, and I'm going to adapt a quote by Dr. King. Are we simply going to be the thermometers that measure the temperature in society? Or are we going to be the thermostats that change the temperature, that change the attitudes, the actions, the priorities of society so they align with God's will and God's kingdom come? And I believe that the church should be and ultimately will be this thermostat, but we have to be ones that change the temperature.